We here at Miles Global would like to present one of our senior consultants, Dr. Tanya Brown. Dr. Tanya Brown brings unique experience to dental teams and dental practices because she has worked in every area of a dental practice, from chairside dental assistant to practice administrator to owner dentist to consultant and speaker. She founded and actively practices at the Center for Cosmetic and Restorative Dentistry. Dr. Brown's practical solutions will help you to be more focused, stay more motivated, and achieve more productivity on a daily basis.
I am so glad that you are participating in this webinar and that you want to learn ways to go paperless and make it quick and easy. So there are many offices that want to go paperless and are looking for a way to bridge the gap between the clinical record and the administrative record, and so I'm going to show you how to connect those dots and put those pieces of the puzzle together in a way that's very simple and easy to implement. So before we dive into going paperless, I want you to know that there are always more than one way to approach things. I'm going to show you the way that has worked best for me and for my clients, but there are other ways to do this. And so every software has different technology and different capability, and I'm going to show you some of the ways that we have implemented this in Dentrix. So the reason for going paperless is that it's so important, and especially now more than ever, is that we must be using the technology to save money and save resources in every area of our practice that's possible. And so anything that can be automated, it's a wonderful idea and a wonderful time saver and a money saver if that can happen. And then the other reason that it's important to go paperless now is because patients almost come in expecting us to be both high-tech and high-touch. So let's get started. You know, some of the benefits to going paperless are that you will definitely save time and you will definitely save money and resources. And in most practices, the largest overhead expense is personnel, and so anything that can be automated will save big dollars to the bottom line. So automating tasks that will allow us to spend more quality times with our patient will have huge payoffs in the end. And so the other benefit to going paperless is it will help simplify treatment planning. Back in the day where paper charts were more prevalent, you would have to almost play chase the chart to find out what the doctor had recommended or find out what notes had been taken in the clinical area before you could check that patient out or before you could set their next appointment. Now with computer systems and many offices having computers in every operatory, now that can be done instantaneously and can be visible by the both clinical team members and the administrative team members. So it just is a wonderful communication tool between the clinical arena and the administrative arena. So that's also one of our next benefits is improving communication between the clinical team and the administrative team. And this is one of the biggest issues in dental practices. You know, sometimes the front office doesn't know what went on in the clinical area and vice versa. And so electronic records give some insight into both sides of the team, and it also eliminates duplication of work. Another benefit is that you're going to enhance the accuracy of your chart notes and documentation and really drastically reduce errors and potential liability. I have a colleague that would for sure tell you to make sure that you have pristine chart documentation. He spent many months in a federal prison for lack of proper chart documentation. So anything that we can do to systemize and to make our chart notations more accurate and more complete is a winner for the practice. And the last part of going paperless that's a benefit to you is improving the dental benefit reimbursement. Because the administrative team will now be able to clearly see the clinical procedures and send those narratives to the insurance companies electronically, which speeds that process along and it helps make that process more accurate and more complete. So, you know, going paperless, we've talked a lot, you know, over the years about going paperless, and this can seem like an insurmountable task, but we all know that the best way to eat an elephant is really one bite at a time. And so the same thing goes for making changes in your dental practice. this isn't going to happen overnight. Your practice wasn't created overnight, and so it will take some time, but setting a plan and setting some benchmarks will help you get there. So the first step is to set some goals of when you want to go paperless. So, for example, in my practice, we said, okay, from July 1st, every new patient that comes into the practice will not have a paper chart, and they will be completely in the computer. So set some goals in the future to start becoming paperless. And, you know, you don't have to scan in all of your existing charts of thousands of pieces of paper. I wouldn't waste that time. What we did in our practice is we already had those charts made. They had already been invested and been documented. So we merely kept those in a storage closet, and if we needed to go back to refer to them, then we could. They were there. So I wouldn't spend a ton of time scanning everything in. I think a lot of offices get bogged down in that scanning process. You know, those referral letters or x-rays or things will always be in that chart, and so you can always go back to them if you need them. But the clinical procedures are already in the computer, and the ledger and all of that stuff is usually already in the computer, and so there's really not a need to go back and scan every piece of paper into the computer. Pertinent documents maybe, but not every single chart, every single piece of paper. So the next step is to set some time for training. If you want to move paperless, we've got to get the team on board, and we have to be very highly trained, because this can be a very stressful endeavor, and we don't want that to happen. So whether you do in-office training, whether you do online training, whether you do this at home, Dentrix has a great online training program that team members can do from any computer, really, and it's their on-demand training. So I would recommend that you either have a professional trainer come in or set some time to do some online training so that you are well-versed in the new computer system, because there's nothing more stressful than coming in on Monday and having a new computer system and nobody knowing how to operate it or how to find the information that they're looking for. So spend that time and set aside that time for training. The next step is to set a start date, to say, okay, at this day, from this day forward, this is when we will be paperless. And to start that process and say, okay, from here we're going to start with our new patients, and then we're going to start with the existing patients, and we're going to convert those records to paperless. And so set a start date so that you have a date on the calendar and everybody's working towards that. And, really the best way is to continually evaluate the process and see where you are and see what needs to be updated and what needs to be implemented. And that will continually evolve as upgrades to your software happen and new technology is introduced. But the best way is to make sure that what is working well, that you continue to do that, and what is not working so well, that maybe you modify that part of the process. So now what? Now you're all excited about the possibilities and the benefits for going paperless, and you realize how beneficial it can be, but now what? How do you go from a stack of paper charts to a streamlined paperless record? Well, let's talk about it. So most offices are already using their computer system or computer software for administrative tasks. Where I find that most dental offices struggle is in the clinical arena. Doctors tell me all the time that they have a hard time translating the information that they're used to finding in their paper chart of where to find that or where to enter that in the computer. So we have really simplified that. And so some of the administrative tasks that are already happening in the computer are billing, are scheduling, and then insurance processing. I know there are probably some other administrative tasks, but these are the main ones that happen from the administrative side. On the clinical side, the things that should be happening in the computer are charting, progress notes or progress records that's documenting each patient visit, and then the other big one is treatment planning. So today, this is the area that we're going to focus on in helping you go paperless, because most offices are already doing the administrative tasks in the computer. So let's talk about what it takes to go paperless in the clinical arena. Well, there's charting, and I'm going to demonstrate how to set up the chart note template in Dentrix. And we're going to use Dentrix as an example because that's what a lot of offices use, but the other software programs have similar capabilities. So once you realize that charting in the computer is actually much faster than on paper, if you have your computer chart set up as closely as possible to your paper chart, and everything can be customized. So you really want to spend that time in the beginning customizing your dental chart, your computer chart, for your style and for your practice. And so the charting piece we're going to briefly mention, but really where we're going to spend some time is the progress notes. This is usually the most time-consuming piece and the one that's the least consistent between team members, and honestly is the most important part of your legal record. So the progress notes, sometimes clients tell me that they will type them in, or sometimes they're still using the paper chart for this piece of the record, or sometimes they have created some templates, or they're using the generic templates that have been created by their software program. But really, I want to take that one step further, because in order to truly customize what you do and minimize the amount of time that you're spending on records, the best way is to have some templates. And so the way we set up the progress note is through our chart note template. And so let's talk about how that is accomplished. I want you to know that the good news is that we have done all the work for you. I have actually created chart note templates for every ADA procedure code, so that really all you have to do is copy and paste them into your dental software one time. And then every time you complete that procedure, the template will be attached to that procedure. So let me demonstrate how this happens. This is Dentrix, which is a wonderful program. This is what we happen to use in our practice. So you would open up the Office Manager and go to Practice Setup and then Procedure Code Setup. And when you do that, then you can click on the different types of codes. So we're just going to use one particular code as an example, as a diagnostic code. And then when you open up, let's just say, for example, the continuing care exam, in this box you'll notice there's a little button that says Edit Note. And that is where your chart note template is going to be copied and pasted. And so these were all created in a Word document, a Microsoft Word document. And so you would simply copy and paste this from the chart note template product into Dentrix or into your computer software, so that now this is attached to that procedure code. So every time the continuing care exam is completed, that procedure note pops up and is attached to that procedure. Now, there are many ways to do this, and sometimes Dentrix trainers will recommend that you attach this to the clinical note, but I have found that this works better and it's visible to both the administrative team and the clinical team if it's attached to the procedure note and it's in these progress notes. But there are other ways to do this. If you wanted to use the clinical notes, then you would simply click this little button that says Copy to Clinical Note, and it would go there versus being in the ledger. So we have this Copy to Procedure Note, but you could alternatively do it Copy to Clinical Notes. The other thing that is a little bit challenging with the clinical notes is those are organized by date, and so you would have to scroll through each date to figure out what procedure was done when, because it's not listed by procedure. So if I want to know what was done to tooth number 3, I can simply scroll back and see that in the ledger and see the note that's attached to it versus trying to find which date that procedure was completed. So there are different ways to do it, but this is the way that I've found that works the best. The other way that I found that this works the best is that the clinical notes are wonderful, and we use those. That's our next webinar to really get into using that higher level multi-codes and clinical notes and questionnaires in Dentrix or in your computer software. But for now, using this really will help both improve your charting system and make things much more efficient, and it's only a one-step click versus having to walk through several steps in the clinical notes. So let me give you a demonstration of how this would work, because once it's set up, all of the work is done for you. So let's pretend that we have the patient chart open, and again, this is in Gentrix, and let's pretend that we set up procedure complete. You can see how now that is visible, the templates are visible attached to that procedure code. And so that's what would be visible both in your chart and as well as in the ledger. So both your clinical team can see it and your administrative team. And so every single time each procedure code is set complete or completed, that note is attached and pops up. So not to get bogged down in so many details, because there are lots of ways to go paperless, and there are lots of different ways to use the charting, but truly this is going to save you time when you go paperless. It absolutely will save you money and resources because using that technology and using that automation is key on saving lots of resources in your practice. It's also going to improve your communication. You know, there's so many times that duplication of efforts is made, you know, trying to find the chart and trying to find what was done at which procedure, and there's mistakes, and you know, it's just part of the process because there's not a streamlined system. And that's what we really want to help you develop, is a streamlined system so that procedures aren't forgotten and mistakes aren't, that they're minimized, and that the communication is improved between the clinical and the administrative team. And then lastly, improving your dental benefit reimbursement. And we need all the help that we can get with communicating with dental benefit companies. And so the more information that the administrative team has, the better they're going to be able to do this. So remember, it's really important, and just like the Nike saying says, just do it. You'll be so glad that you did. I am certainly here as a resource to support your efforts in going paperless, and truly the only regret you'll have is that you didn't do it sooner.